I'm Dr. Rajni Gupta, Senior Consultant Radiation Oncologist at Apollo Hospitals, Chennai, Dynampath. There are certain myths in the society. Not certain, there are many myths. First of all, that breast cancer is only a women disease. It's not like that. 1% of the males can also get breast cancer. So they also have to check their breast regularly. So that is one thing. Second thing is, like, cancer is contagious. What happen is, whenever somebody is having the cancer in the family, other family members, they will not allow children to go to the to that person who is sick. Already he is sick, he will become more sick because of the loneliness. So don't do that. It is not at all contagious. They can play with the kids, they can do anything. So another thing is, people think that if we get cancer or breast cancer, that is a death sentence. It is not a death sentence anymore, because in olden days we didn't have the proper screening techniques, proper treatment methods, but now we have a very good screening techniques where we can pick up the cancer earlier, and if we pick up the cancer earlier, it will be cured to 98%. Apart from that, picking up the cancer earlier will help you. If somebody is detected with the cancer in the family, all of us will get emotionally and psychologically burdened. Apart from that, there is a big financial burden on on the family. So all these things can be avoided if we detect the cancer earlier. And apart from that, there is one more myth that we can treat the cancer and it is not a death sentence. Apart from that, there are certain other myths, like uh, painless lump cannot be a cancer. It's not like that. Usually, to start with, the lumps are only painless, and if it is a painless lump, please do investigate it, because all the cancers will start as a painless lump and then later on it becomes painful. So there are certain other myths which are in the society. One is very great myth that all cancers, all breast cancers are hereditary. But as I told you earlier also, that it is not at all. Only 5 to 10% of the breast cancers are hereditary, and 80 to 90% are because of our lifestyle and our diet habits. So in hereditary, like, many people think that if in my family multiple people have, like my mother, my sister, everybody has breast cancer, I will also get. It's not like that. As I told you, it is because of our habits and lifestyle. You can modify that and you can prevent the breast cancer. And on the other side, people think that if nobody in my family has breast cancer, I will not get. But that is also a myth. If you have a very faulty lifestyle, then you are prone for breast cancer. So your lifestyle plays a major role in that. And then second thing is, people think that any lump, if they palpate any lump, they are immediately getting very scared and they think that this is a cancer. But it's not like that. I told you earlier also that any lump, like especially in the breast, in 80 to 90% of the lumps are benign. Only 10% lumps are maybe malignant. So we need not to get scared. If you find any lump, please go for investigation, get it checked, and then if it is benign, then you need not to bother about. So that is the most important thing. Apart from that, there are certain other myths that if you wear tight inners and bras and all that, you will get cancer. It's not like that. It is not at all proved anywhere. And but in fact, you have to wear the bra which is correctly fitting, because it will hold the breast correctly, otherwise the breast sagging will be there. So that is another myth. There is one very big myth in the society that if you breastfeed your child, your figure will be bad or something like that. You should not breastfeed your child. It's not like that. Breastfeeding is very, very important. If you breastfeed your child for at least 2 years, it will in fact prevent you from the cancer. So it's a very good thing. You should give the breastfeeding for at least 2 years. You should not think about your figure or something like that. And even your figure will be better if you give the breastfeeding. So, one more thing which I like to tell is, there is, like, there are many people who go to Ayurveda and homeopathy for the treatment, because they think that they think, as well as the those people who are treating, they are also telling that if you go to the allopathy doctor, they will just cut down your breast. This is not at all correct. It all depends upon the stage of the cancer, and nowadays we do mostly breast conservation surgery as far as possible. So there is nothing that we'll put you and we'll cut your breast, nothing like that. So in fact, I had a patient when the patient went to a Ayurveda doctor, with very small lump in the breast, maybe stage 1 or something. And then they gave the treatment for 6 months or 8 months, and then by the time they came back to us, then it was stage 4, we could not do anything, and finally she passed away. So this is what is happening. So please don't believe on Ayurveda and all. It can be a treatment for a very minor diseases, minor illness, like fever, cough, cold. You can take treatment with Ayurveda and homeopathy, but not with the major diseases, because the more toxic is the disease, you need the more toxic treatment. So that is where these myths are standing in the society and spread by all other people. Please do not believe it. If you have anything, go to a proper doctor, proper consultant, discuss it, and then decide what further you want to do. So finally, take home message is that cancer is very, very preventable if you change your lifestyle, your dietary habit, and maintain means proper weight. So that is very important. Apart from that, cancer can be treatable in any stage, may it be stage 1 or stage 4, and it depends upon the stage how we treat it. So please go for breast self-examination, screening, diagnose the cancer earlier, because earlier detection will give you 100% cure. So try to help us and detect the cancer early.